Good morning, it's Dr. Garrett and I am here at Empowering Health. Now today I wanted to talk to you a little bit about hair restoration with PRP, Celluma, microneedling, and PDO threads. So a lot of people ask us, are there options for hair loss? There are. Now, as we age, hair thinning is very common. If you have issues with your thyroid, with low vitamin D levels, even if your hormones are out of balance, you will notice hair thinning. So there are some options that we can do. Now, if there is a hair follicle that is still present, we are able to stimulate collagen and cause that to grow again, stronger, healthier, thicker. And there are a few options we can do with that. Now, if there's not a hair follicle present, or if there's never been those types of hair follicles, hair restoration in that area is not possible with what we have. You can always do plugs and things like that. But let's talk about what we can do here at Empowering Health. So, PRP. It is one of my favorite treatments for a variety of things. It's an autologous filler, meaning that it is your own body products. We are drawing your blood, spinning it down, and activating it. Now, typically for hair restoration, I activate it with something called sodium bicarbonate. This causes that beautiful liquid gold, that plasma that sits on top of the red blood cells, to be activated. And what are we activating? We are activating stem cells, growth factors, hormones, enzymes, all of these things that tell the body, hey, we need to fix something in this area. So then it causes the body to mount an immune response to cause hair growth, to stimulate, to nourish. So what happens during this treatment? You come in, we do some pictures, we look at the hair thinning, we figure out the best place. We do what we call a lidocaine ring block. So we're blocking off the top half of the head here with some lidocaine. That way it's a little bit more comfortable for you. We're drawing your blood, spinning it down, activating that PRP. And then what we do is we inject it into these areas. It is a very thin type of consistency. So it tends to have some hydrodissection, meaning that it goes really far and spreads very wide. Now, it is a little uncomfortable. That's why we are using the sodium bicarb 1 and 2 while we're doing the ring block. Now, if you want to do it all natural without the lidocaine, we can do it, but it does burn a little bit for about 5 minutes. Now, after we get that PRP into place, we can do a couple other things. Now, if you notice that you have hair thinning like along a part line or one particular area, we can put PDO threads in there. PDO threads are polydiaxylone threads, which means it's an absorbable type of suture. When we place it up underneath the skin, the body sees it as a foreign substance and it mounts an immune response around it and builds collagen in that area. We know that collagen is the foundation of healthy skin, hair, and nails, so it kind of just regrows things in there. Now, the other option is we can do microneedling with it. Microneedling is where we use a FDA-approved device like our RejuvaPen, and we are causing some controlled injuries into that collagen layer. With this controlled injury, again, the body is mounting an immune response going in and healing the area, which does an amazing job. Now, after we decide which treatment, whether it's the PDO threads for more thinner areas and like more specific areas, or if it's more global for the microneedling, then we're going to put you under our Celluma device. Now, Celluma is an amazing device. It is using a very certain type of laser, which is a red light laser that causes the body to cause more healing in that area. We use our Celluma for a variety of things, for acne, for wrinkle reduction, for bruising, but it works wonderfully for hair restoration. So what we do is we set you in our chair and then we put the Celluma over top. You can sit there, read a book, work on your computer. You can watch TV, watch your phone, whatever you want to do for about a half an hour. Now, with hair restoration, we do recommend that you come back in 6 weeks. And we're going to do a series of 4 treatments of whatever we have decided to do, whether that's the PRP with microneedling and then Celluma, or the PRP, PDO threads, and then Celluma. Now, we will talk to you about vitamin supplements, what to stay away from, like ibuprofen, because we want an immune response. We want that inflammation, because that's what's going to cause that healing cascade. So, we will talk to you about all the things that you need to avoid, how it works, and then we'll see you back every 6 weeks. Now, we will start noticing hair growth pretty decently by about 6 months after your first treatment. So this isn't necessarily one of those things where you do it today and boom, tomorrow you have a full luscious head of hair. It does take a little bit of time to start noticing that thicker hair growth, that improved keratin within the skin, and just the improved vascularity there. So we love our hair restoration. We have had wonderful results with it, and we can't wait to share it with you. If you have any questions, or if you'd like to get in for a consultation to see Susan or I, call the office, 812-290-2128. Have a lovely day.